Have you experienced toothache before? It is terrible. You don't know what to do. And it's the weekend and you cannot see the dentist until Monday. Well, on today's episode, I want to share with you some natural remedies that you can do until you're able to see your doctor to help you reduce the pain because the discomfort and the pain from toothache can be very terrible. In fact, yesterday, one of my friends had a toothache and he used some of these natural remedies to give me relief until he was able to see the dentist. So I think sharing this with you and having this in your portfolio will help you because you never know who is going to experience toothache in your home or maybe yourself. So let's dive into it. What are the natural ways to relieve the pain and the discomfort from toothache until you see the dentist? The first one is clove oil. Clove oil, time and time again, has been shown to relieve people having toothache. Why? Because it contains eugenol, and eugenol is a natural antiseptic and also anesthetic that will help reduce the pain and numb the area. And how do you use that? Well, you have clove oil at home, get some clove oil, put a few drops, and also dilute that with either coconut oil or with olive oil, and then put a cotton ball in it, dab into it, and then put in the area where the pain is. And do it a couple of times a day. It's going to numb the area and you have some relief from the pain. Now, warning, do not apply the clove oil directly to your gum or to your teeth because it's going to irritate the pain, the place more, and also people may have allergic reaction to the clove oil. So make sure you dilute it before you do it. The second thing you want to do is to rinse your mouth with salt water. Well, everybody knows this, right? You take some salt, put it in warm water, and you gargle a few times. Why would you do that? Because salt has a natural disinfecting property and to aid in decreasing the inflammation and also to treat oral sores if you have them in your mouth. So by gargling salt water a few times a day, that can also reduce the pain and give you some comfort until you're able to see your dentist. Another thing that you can do that can help you with tooth pain is to use garlic. Yes, garlic. It smells bad, but it's going to help you to reduce the inflammation. Now, how does it work? Garlic contains a substance called allicin, and allicin is like an antibiotic or it has an anti-inflammatory property. So when you crush a garlic, it will release the allicin. And what you want to do is that the crushed garlic with the release of allicin, you can place it in the area where you have the pain, and then it will reduce the inflammation and give you some comfort. Now, warning, it's going to make your breath smells bad. Who cares? What you're interested in is to get the pain relief if you're having severe toothache. Another thing that you can do is peppermint tea bag. Peppermint tea bag. Now, peppermint has menthol in it, which again will numb the place out for you. So how do you apply that? When you brew your tea with a peppermint tea bag, you remove it, let it cool down a little bit. When it's a little warm, you can apply in the area where you have the toothache, and it's going to soothe the area, numb the area nicely for you, and you have some comfort until you see your dentist. The next thing you want to do if you have starting from toothache is to get hydrogen peroxide. Hydrogen peroxide, what's going to do is that it's going to remove all the bacteria and the debris that is in your teeth that is causing infection or whatever is causing the inflammation. But you don't want to apply it directly. You take a 3% solution of hydrogen peroxide, dilute it, and then use that to wash your mouth a couple of times a day, and that is also going to help. Another thing you can do is using an ice pack. The ice pack, what you do is that you take an ice, you wrap it in a cloth, don't put the ice directly. So put the ice pack on your cheek area or your jaw area where the pain is, the tooth is bothering you, and that's going to reduce the inflammation, reduce the swelling, and also give you some relief until you see your doctor. Another thing that has been shown to work is to use apple cider vinegar. Apple cider vinegar. And why does it work? Because it contains anti-inflammatory property and antiseptic property. And so the way you use that is to soak a cotton ball into an apple cider, and then you put it in the area of the damaged tooth. And because of the anti-inflammatory and antiseptic property, it will reduce the inflammation, and that will give you some relief. Alternatively, what you can do, you can dilute apple cider, dilute it, and use as a mouthwash a couple of times a day whilst you wait to see the dentist. Another thing that can also help you is warm salt compress, warm salt compress. So you take some salt, you put it in a warm water, dilute it, and then what you do is that you can take a cloth and then soak the cloth and you apply it outside of your jaw where the pain is. Don't put it inside where the pain is, outside of your jaw where the pain is. And the warmth from that will also cause a rush of blood to the area, reduces inflammation, and that can also give you some relief. Now, if you've done all these and you're still in a lot of pain, of course, you can take some over-the-counter NSAIDs. Now, NSAIDs like ibuprofen, Advil, naproxen, diclofenac, you can take them. But the key is that if you have a kidney problem or if you have ulcers, you don't want to take ibuprofen or any of these NSAIDs because that can screw up your kidneys. You don't want to do that. So you don't have any kidney problem, you don't have any ulcers, then ibuprofen or the NSAIDs will be okay to take. Now, if you have to take them, make sure you don't take them on an empty stomach. Don't take it more than 3 days until you see your dentist. If you have a kidney problem or you have an ulcer, alternatively, you can take some Tylenol to ease the pain until you see your dentist. So that is how you get rid of your pain or to lessen the pain when you're having a toothache. Now, all of us, one time or the other, are going to need it. So make sure you keep this information in your portfolio because you never know when you're going to need it. Remember, we're in the 21st century and these days you are on your own doctor. So having certain information in your arsenal will help you a long way before you see your doctor. So until then, I want you to subscribe to my channel, like my channel, and leave me a comment. And until then, this is Dr. Moses. I'll see you again in the next video.